Ladies and gentlemen, and online viewers from all around the world, welcome to Taiwan Contactless Healthcare Solution webinar. I'm Winnie. It's my pleasure to be your EMC today. To begin this webinar, we are pleased to have Ms. Michelle Wu, the Deputy Director of Strategy Marketing Department from TaiTra, to deliver the opening remark. Ms. Wu, please.
Thank you. Distinguished guests and speakers from Taiwan's well-known zero-touch healthcare solution suppliers. Ladies and gentlemen, good afternoon in Taiwan, Asia, and the Middle East, and good morning in Europe. On behalf of the Taiwan External Trade Development Council, I would like to extend a warm welcome to everyone participating in today's Taiwan Zero-Touch Healthcare Solution webinar. In the post-coronavirus world, the healthcare industry will face many challenges as well as great opportunities. Zero-touch healthcare solution could help contain and prevent future outbreaks. We are honored to have 4 Taiwanese companies join our today's webinar. Through today's event, you will know how Taiwanese companies integrate information and communication technology into anti-epidemic applications, including the rapid deployment of the telehealth solution and the Nasal Swab robot, the body temperature monitoring solution, and the interactive health kiosk. If you want to know more about their product, TaiTra is happy to schedule free online trade meeting after this webinar. Before finish my speech, I would like to thank you again for participating in today's event. I hope you can find a suitable product or solutions to defend the coronavirus in this event. And finally, I would like to wish you all good health and to stay safe during this challenging time. Thank you.
Thank you, Ms. Wu, for your informative remarks. We're going to move on our next section. We'll have 4 presenters that represent different suppliers and for the contactless healthcare solution. If you have any question during the webinar, please scan the QA link on the bottom of the screen, and we will be answering the questions in the QA session. And next, let's start the first presentation by Ms. Zheng Kai Zhang from Advantech Co. to introduce their rapid development of telehealth solution. Mr. Zhang, please.
Good afternoon, everyone. My name is Jun Kai, and I'm the Business Development Manager for Telehealth Business in Advantech. It's my pleasure to be here, and I would like to introduce you our telehealth solution. Basically, our telehealth solution is providing medical professionals a telehealth card, and it can be seen as a mobile workstation that is equipped with a video conferencing system and a medical computer and battery system. For video conferencing system, it features a high-quality PTZ camera that supports full HD resolution and 18 times optical zoom, and a high-quality speakerphone that supports digital signal processing technology and echo cancellation, which allows the doctors and patients can see and hear each other very clearly, even they are not at the same place. And the telehealth card also has a medical computer, so it has a wide touch screen that is specifically designed for medical environment, and it supports fast data transmission and data computing. And the work surface of the telehealth card is waterproof and dustproof, and it's very easy for daily decontamination. And it also has a drawer to store some documents and medical devices. And it also features electronic height adjustment, so it can be used in a more ergonomic way. And as a mobile workstation, the telehealth card has a battery power system and with 8 to 10 hours battery life, which means medical professionals can use the telehealth card without charging during a whole shift in hospital. And the battery power can be remotely monitored by intelligent power management software. So with a mobile workstation, the healthcare providers and the patients can connect with each other to provide healthcare services anywhere and anytime. No matter it's for inpatient care like emergency department or ICU or isolation room for COVID-19 or even routine ward rounds, or for outpatient care like rural area in community clinics or health centers, or even for long-term cares, our telehealth solution can be well applied into these scenarios. So why do healthcare providers need our telehealth solution? For example, medical professionals can use our telehealth card to do virtual ward rounds in hospital, which can save more time and expand doctors' capacity to care patients. And the virtual ward rounds is more and more popular around the world. And the telehealth solution can also help build the virtual clinic in the rural areas to increase the accessibilities to medical resources. For ICU and ER, the telehealth solution can fill the staffing gap and reduce patients' waiting time by a virtual cooperation between bedside staff and the remote care teams to give joint treatment for the patients. And the telehealth solution can also protect medical professionals from infection by reducing the frequency of entering the isolation room, but still can give the treatment for the isolated patients. Last but not least, medical education like surgery demonstration or medical conferences can be assisted by telehealth solution to maximize their effectiveness. So our solution, besides telehealth card, our solution also includes a video conferencing software, which is HIPAA compliant that secures data, secures patients' data and patients' privacy. And it also supports remote camera control, remote annotation, and most importantly, it supports video streaming from third parties medical devices like digital exam scope, EKG, and ultrasound. Our solution also includes a digital exam scope, which is comprised of one control unit with 3 exchangeable lenses, which are a general scope, an otoscope for ear examination, and a dermatoscope for skin examination. The images can be transmitted in real time, which gives the doctor at the remote site more evidence to do more precise diagnosis. So here I prepared 4 use cases for you to have a deeper understanding of how telehealth solution works in the real world. The first one is in Taiwan, and it's a teleconsultation in rural area. In rural area, most diabetic patients are elder people, and they have to travel a long distance to have regular eye examination at medical centers in urban area, which is very time-consuming and exhausting. So with our solution deployed in the community, in the rural areas health center, the patients can easily access the specialist for eye examination and get treatment recommendations by just visiting the nearby health centers. And the second use case is also in Taiwan, but it's a dermatology teleconsultation in mountain area. But the concept is quite similar to the first case, which our solution is deployed in the community clinic and which allows the patients, the residents in the mountain area can access the dermatologist directly. And the third case is in the Middle East, in Qatar. And there is a large medical corporation called HMC, which operates 9 hospitals in Qatar. And according to a report, HMC received around 1,600 stroke patients every year, but unfortunately, the number of the doctors is insufficient for each hospital to give immediate assessment to the stroke patients because there are too many patients waiting in the emergency room. So HMC placed our solution, placed our telehealth card into the ER in each hospital, and used the telehealth card to connect a centralized remote stroke team to do patient assessment and give treatment advices. In this way, HMC can increase the efficiency of handling the stroke patient without hiring more medical professionals. And the last case is in the US, and there is a large health system called Banner Health, which runs 28 hospitals across 6 states. Even a large health system like Banner Health is still facing a physician shortage, especially in the ICU. So Banner Health put our telehealth card on the bedside in the ICU, and the bedside nurse can use the telehealth card to cooperate with the remote physician team to give a joint treatment for the patient. So the benefit of the telehealth solution here is very obvious because it increases the efficiency but reduces the cost. Besides telehealth card, we are going to launch a telehealth suitcase, and this portable suitcase could support a more extensive application, especially for on-site services like emergency care, home care, and even for military medicine. So if you are interested in our solution, please feel free to contact me for more information. Thank you.
Thank you, Mr. Zhang, for your sharing. I would now like to welcome our next speaker, Dr. Jerry Chen from Brain Navi Biotechnology Co., to present their Nasal Swab robot. Let's welcome Dr. Chen, please.
Hi, good afternoon, the friends in Asia, and good morning, the friends in Europe. I'm Jerry Chen, the CEO of Brain Navi Biotechnology. Today we are going to talk about our new product. It's called Nasal Swab robot, and we are going to propose a COVID-free flight concept. Our company was established in 2015, and we have more than 30 employees right now. And in the last 5 years, we got more than 20 patents granted, and more than 30 patents is now keep going. Our nasal swab robot is actually the first and right now the only nasal swab robot in the world that is authorized by a local government. So we got the Taiwan's EUA approval, and we are waiting for United States EUA approval. And we know that medical doctors face the pandemic all the time. 17 years ago, we have SARS. Right now, we have COVID-19. But the medical doctors are still doing the same thing, the same way. The nasal swab, they are risking their lives doing the same procedures because the nasal swab procedure can cause a lot of risk for infections. So how can we help them with our new technique? We know that since this pandemic, until now, there are more than 200,000 of medical staff get infected or even death. Only in the United States, there are more than 1,700 nurses died from COVID-19. So how can we protect them? If they cannot be protected, who can protect us? So we know that there is a report that more than 60% of the nurses and doctors, they are considering leave their jobs because they don't want to take any more risk. However, I think we can help with our technique. We know that they are protecting our lives, but who protect them? So we develop a nasal swab robot. Because I myself is a surgeon, I think the most important thing is not only the diagnostic, but also the way that the medical doctors and nurses being protected. So using a robot to do the risky procedures instead of let them take the risk. So This is actually how the robot is doing. This is the first in human nasal swab robot case. We developed a patented nasal clip that the nasal clip can let the robot to identify your nose and your facial structure very easily. So from getting the swab from the tube and to finish the process all by the robot and without any contact to nurses and doctors. After grasping the swab, the robot will come to in front of your face and take two pictures. One is for your face and another is for your profile. The face pictures is being used to identify your nostrils, so the robot will know where to put the swab in. And the profile pictures will be used to calculate the depth from your nose to your ears. So that is actually the distance and the angle that the CDC suggested for nasal swab procedures. So it will enter in your nose very gently and swabbing, rotating by itself and very, very gently and softly. So based on our clinical trial, actually the pain score is less than humans. So after doing the swab, it will go back into the collecting tube by itself also. So there's no chance to get infected by these procedures. Okay, so the process is finished. And then we use some technique. First is the facial recognition. We will notice, the robot will recognize your face by after several clips on the monitor, and it is free. It is very easy to use and very easy to learn. So you don't have to learn how to remote control the robot. So it is an autopilot way robot. And then we can calculate the distance from your nose to ear, so we know the position of your nasal pharynx and do the auto sampling by itself. And the nasal swab robot is not only a robot, it is a setting of a whole environment, including a shell stand to separate the environment from the patient to the doctors and nurses. And not only this, we also design chin holders. So you can put your chin onto the chin holders and very easily and comfortably. And if you feel any discomfort during the process, you just leave very safe. So it will be very comfortable and very safe for the patient. And not only the robot, we also combining the testing tools, such that we can combine with the mini PCRs, so we can provide a total solution from the swabbing to the PCR report within 25 minutes. So I think this way can reopen the economy very easily and very efficiently. So we know that a lot of airlines and airports are doing the pre-boarding screening, such like the United States, Germany, and Japan. They are doing this way, but they still need a lot of manpower to do so. But with our technique, you can use a very limited manpower to provide the same service or even better service than the previous one. And we have already been used in 3 hospitals in Taiwan, and all the cases were done very perfectly, and everybody feels, wow, it's actually not bad. So I think we have some interview with the examiners, the participants. They said that there is even no pain at all, or even we have a friend from Italy. He says that, well, it's actually not bad. Actually the same as I received by human, or even comfortable by humans. And we also collaborate with our clients in South Africa to provide a remote medical cars that combine a container with, and within this container we can have 2 sets of nasal swab robot and several sets of mini PCR. So you can deliver the service in anywhere, anytime you want, and with very limited manpower, and provide a high quality test. Not only doing the swab, but also the PCR test within this trunk. So I think we are looking for some distributors, and we are looking for some partnerships, such as the medical groups, the airlines, airports, and some facilities and companies. So we want to provide this kind of solution to reopen the economy more safely and more accurate with these accurate reports. So we can, we not only want to save life, but we want to save our lives, reopen and normalize our lives. Thank you very much.
Thank you, Dr. Chen. It's really interesting and informative. And I would like to kindly remind every attendee to leave your question in Slido by scanning the QA link at the bottom of the screen, if you have any. The questions will be answered during the QA session. Now, I'd like to invite you to watch a video about the temperature monitoring solution from IEI Integration Corp. And next, Ms. Jenny Liu from IEI will make a presentation. Let's enjoy the video first.
Hello, we are IEI Integration Corp. IEI is a leading industrial computer provider from Taiwan. Recently, we have launched a brand new solution, and we would like to share this amazing product with you. It is the IEI's body temperature monitoring solution. This system is integrated with IEI all-in-one medical panel PC and thermal camera. It can be deployed in various fields like security, retail, business, buildings, or transportation. With the solution developed by IEI, temperature and facial identification can be detected accurately even when wearing masks. Amazingly, no false alarms when holding hot drink. This system can detect up to 30 people's temperature at the same time. Also, when detecting a high temperature, an alarm will be triggered to notify the person in charge. The person with a high temperature can be easily found by comparing the recognized face and the temperature data. You should also know that this system is accurate to within 0.3 degrees Celsius. The value and the detection range can be adjusted according to users' needs. The measurement record can be downloaded for future reference. Very convenient. IEI's body temperature monitoring system uses IEI POCI series, medical panel PC, and a thermal camera. It can reduce the workload, improve the efficiency of temperature measurements. Let IEI work hand in hand with you to protect our homeland and combat the pandemic together. Let us be your best partner for pandemic prevention. Next, we will have more detailed information delivered to you in our following presentation. Thank you.
Hi, everyone. I'm Jenny Liu. I'm Senior Sales from IEI Integration Corporation. Thanks, Taitra, to having IEI to join this event this time, especially during this challenging time. IEI is established in 1997 in Taiwan. We are dedicated ourselves in industrial computing solutions in various applications and vertical markets, accordingly in healthcare field. From this slide, you will see this is the overview of IEI's efforts to assist customers in the hospitals and healthcare centers to deploy their technology and with IEI medical computing solutions, such as the EMR or vital sign measurement equipment for OPD, and also the self-service kiosk in lobby. Also, medical AI computing solutions for pathology. Meanwhile, in the world, IEI also provide the patient engagement solutions with customers. For the inpatient department with IEI mobile nursing station and the medical imaging archiving solutions for radiology. Before getting to the topic, and also from the video before my presentation, we all know COVID-19 outbreak really caused a very deep impact in the beginning of this year. However, a crisis could be a turning point as long as we found a good solution. From this chart, you will see to measure temperature is really important. According to the CDC's analysis, around 50% of people, they will get a higher fever when they diagnosed by the COVID-19. Later on, maybe a dry cough or a shortness of breath, etc. But to measure the body temperature on the forehead or by ear thermometers may take only one time and only one person. Also, it is also difficult to measure the temperature in the public, especially for the crowded. Meanwhile, a false alarm caused by the hot objects is also challenging, especially for the medical infra. IEI provide a plug-and-play body temperature monitoring solutions, especially for the people, also for the crowded, to have an automatic temperature measurement. Like you see here, it contains IEI Medical Certified Panel PC and also with a high-resolution thermal camera. In this solution, over 30 people can be measured in one time with very tiny temperature accuracy to measure the body temperature. From this slide, you will see more details. What is the advantage of it? Like I said, over 30 people in one time and with less than 0.3 degrees with the temperature accuracy. Also, in a certain distance, like 3 to 5 meters, so that this solution can be proceed. And IEI provide this solution, which can be utilized in many places, not only in the hospital, but also for some places with the people who want to make a deep and fast screening, such as in the shopping mall, for the railway station, and also for some government facilities. Recently, we have many success stories in Taiwan, especially not only in the hospitals, but also in the schools, some institutes and stadiums. And also, we have some very success story in Japan and Europe. Back to the topic. From this part of the topic, and I believe everyone agrees that epidemic situation may remain in a certain time. That's the reason we want to highly recommend it our audience to consider this special package. Let's take this panel PC as an example. It is powered by Intel 8th generation CPU. We also offer a commonly see features for the medical frontline. It can be function like a DICOM viewer or a gateway, especially for the telemedicine applications, which is in a very growing fast market in the following years. Also, we want to highlight this product, which is our flagship product line, POC-M series. Empower the system with 3 hot swappable batteries. And also this product is the winner of Taiwan Excellence and also IF Design Award. From this picture, it is showing our success stories worldwide, and we do appreciate have such experience with our valuable partners in the global market. We are also looking forward for more opportunity with the audience like you. Thank you for your attention.
Thank you, Ms. Liu. Next, let's welcome Ms. Ruby Chen from TaiDoc Technology Corp to give us a presentation about interactive health kiosk. Ms. Chen, please.
Hello, everyone. First of all, I would like to thank Taitra for the invitation for us to join this event to have the chance to introduce you our company TaiDoc and our new product Health Kiosk. Here's the table of contents. First, I'm going to introduce you our general structures and milestones of TaiDoc. Second, I would like to introduce you our research and development advantage. And with the integration of our technology, we have developed our new product segment for remote monitoring system for our new product, Health Kiosk. Let's move on to our first topic, company profile. We, TaiDoc, we are an R&D-oriented company specialized in OEM/ODM capability. With over 20 years of professional experiences, we became a listed company in Taiwan. Internationally, we have achieved our worldwide presence with our overall solution. Our vision is to be the leading medical supplier in Taiwan, and moreover, to be diabetes and telehealth solution provider. Here's the milestone of TaiDoc. We established in 1998, and in 2003, we have built up our ISO system center. And the next year, we have started up our development for IVDD diagnostics products. And based on our continuously efforts, we have developed a wide range of products from IVDD to MDD. And in 2019, we have integrated our standalone devices into our comprehensive system, Health Kiosk. All of our factories are all located in Taiwan. In Taipei, we have our headquarters, which we have the R&D departments and also for our medical device production facilities. And in Taiwan, we basically focus on the biochemistry parts for the strips production. As you can see, we have all necessary certificates. We have ISO GMP for our manufacturing facilities and IVDD and MDD for our products. And also, we have rich experiences of helping our customers to apply the certificates for local markets. Second, I would like to introduce you our research and development advantage. With over 700 employees in TaiDoc, we have 19% of our human resources are in R&D departments. And we also invest over 8% of our annual sales revenue to continue our development for innovation and improvement. With over 100 of engineers in TaiDoc, we provide a one-stop service from the very beginning, mechanical and tooling design to build up the hardware structure. And the combination of our software programming, we can integrate our standalone devices into a comprehensive system. Furthermore, we have our own regulatory and affairs team, which can fulfill the international standard for CE and FDA. Well, with variety of apps are provided, we have fulfilled our four main product lines for diagnostics, home care, professional, and telehealth. And now we have moved on to develop our new product segment for remote monitoring system, develop our new product, Health Kiosk. We have cooperated with ITRI, which is the Industrial Technology Research Institute in Taiwan, and developed this product. It is the medical-grade product, which we have received our CE approval at 2020. First of all, I would like to introduce you our Health Kiosk. It's the medical device with multi-parameters, such as blood oxygen saturation, respiration rate, temperature, ECG, weight, blood pressure, and height embedded. With the camera on its top of kiosk, it provides two functions. First, detect the user's height. Second, facial recognition. Also, through its interactive interface, it guides the users to complete the vital signs measurements step by step. And furthermore, it provides additional assistance, such as voice guidance. During this COVID-19 pandemic, our health kiosk will be the best solution to help. In addition, it records and measures all the results automatically and uploads the health information on hospital information system. By measuring and analyzing the biological data and combining with our cutting-edge artificial intelligence technology, our health kiosk could bring you whole new experiences far beyond your imagination. And here is our introduction video for our health kiosk.
Do you smoke? Do you have any allergies? If yes, please specify.
So thanks for their attention.
Thank you, Ms. Chen. Thank you, Ms. Chen, for your presentation. I'm sure all of us find today's presentation informative and useful. And now let's move on to QA session. We have received some questions from you. Due to the time constraint, we'll only pick a few of them for the QA session. For the unanswering questions, you will be answered in the following weeks. For question number 1 is for Advantech. Do you have any distributors in Europe? And let's welcome Mr. Zhang to answer this question, please.
Okay, thanks for the question. And yes, we do have a channel partner in Europe called Alphatron, but we still have our branch company in Netherlands and Germany. And we are welcome everyone to join us to become our channel partners or distributors for the worldwide business. Thank you.
Thank you, Mr. Zhang, for answering. And the next question is for Brain Navi. The question will be, have you applied for FDA approval in other countries? And let's welcome Dr. Chen to answer this question, please.
Hi, our nasal swab robot has already got approval from Taiwan FDA. And we are right now applying for United FDA approval right now. And we know that for the pandemic, actually every country has its pathway, such like EUA procedures, processes. So we are looking for distributors to help us to go through the country. If you want this product, we are welcome any partnerships or distributors to help us to get the FDA or other countries' EUA process. Thank you very much.
Thank you, Mr. Chen, for answering. And for question number 3, it's IEI. Do you have any application cases in hospitals? And let's welcome Ms. Liu to answer this question, please.
Yeah, thank you very much for these questions. Yes, we do have many applications in the hospital, not only in Taiwan, but also in the US and Australia and also in Europe, like the mobile nursing station, what I mentioned in the presentation. And also we have some experience with the partners to work on in the OR, operating room, this kind of solution. So if you would like to know more information, you can also contact us. And don't forget to join our Medical e-Forum next week.
Thank you, Ms. Liu. And for number 4, it's also for IEI. Do you have any agent in Japan? And what are the market price and retailer price for body temperature monitoring solution? Let's welcome Ms. Liu again.
And thank you for this question again. And we do open for any possible partnership, not only for the customer or the audience in front of us. And for Japan, yes, we do open for discussion about this topic. And you can also email me and contact us later, and we can have a live conference call together later on. Thank you.
Thank you, Ms. Liu, for answering. And for question number 5 is for TaiDoc. Did your health kiosk get any medical device approval in Asia? And let's welcome Ms. Chen to answer this question.
Yes, right now we have only held with C certificates. However, we are now discussing with several partners in Asia and Europe as well. And now we're also open for discussion for our partnership and cooperation. Thank you.
Thank you, Ms. Chen, for your answering. And thank you all for spending time with us today. We hope this event has provided rich information. After this webinar, we will send out the presentation from today's speakers, the response for today's unanswered questions, as well as a questionnaire. We'll also facilitate further one-on-one meeting according to your need. Thank you again and looking forward to receiving your feedback. Have a nice remaining day. Thank you.